Hey, Cam followers, we're back again. It's been a massive week. This is going to be lovely. This is seriously going to be lovely. So please meet Dr. Jessica Rychel. She is here all the way from Colorado. They're just about to have an impressive snowstorm hit. So I hope we're going to get this done before you're running for the door going, I've got to get home, I've got to get home. Please tell the Cam followers about yourself, how you've got to be where you are, your journey here, because everybody loves the stories that come with the guests. So tell us.
Great. Hi, Cam followers. I'm so glad you're here and interested in canine arthritis because it has been a passion of mine for my entire career and something that drives me to get out of bed every day and come to work because I love helping canine patients both here in Colorado, but also across the seas to regain their health and wellness and comfort through the things that we'll talk about today and that you've talked about in so many interviews past. So I work at a little practice called Red Sage Integrated Veterinary Partners. We have a rehab and pain management service as well as an internal medicine service. So those are the only services that we have here in our clinic. It's really geared toward helping and treating middle-aged to geriatric pets who are dealing with chronic pain issues, whether those are traditional arthritis issues to the injuries that happened earlier on that cause those secondary arthritis issues down the line. And then we have an internal medicine service because, as we know, a lot of our geriatric patients have compounding diseases that can make their pain issues more life-threatening and also more painful. So that's what we do here. It's a quaint little tiny practice that's really dedicated to mostly hands-on therapy and educating our clients the way that I hope to bring you some little pearls of wisdom today.
You will. But you started back in university, didn't you?
So I did start. Yep. So I went to veterinary school and here in Colorado, we're up in the mountains. I was an alpine ski racer before I went to veterinary school. And so that gave me a background in both athletics and in the injury side of athletics, the physical therapy side of it, the pain management side of it, because you can't be an alpine ski racer without serious knee injuries and back injuries and foot injuries and everything else. And so when I went to veterinary school, it was at a time when the TPLO surgery was just really taking off. And, we would see clients paying thousands of dollars for their dog to have this really fancy, really advanced surgery with the hope that they could get that dog back to hiking in the mountains, playing fly ball, fetching their stick, going hunting, whatever it was that client wanted to do with that pet. That was the hope, is that they could spend a whole bunch of money on this really expensive surgery and end up with a normal knee and a normal lifetime for that pet. Unfortunately, what we often saw is those pets went into a crate after surgery. Sometimes their pain was not well managed. In fact, most of the time their pain was not well managed. And what we would see is those pets would try to return to their normal athletic lifestyle and unfortunately would not be able to. There would be ongoing arthritis, lameness, pain, sometimes debilitatingly so, even in these young to middle-aged dogs. And so when I went to veterinary school and saw that happening, I immediately said, I want to do something different. I don't want to do general practice. I don't want to do specialty practice even, because there's not the specialty program for me. Pain management is what I want to do. And so I really dropped the rest of my learning goals, or my career goals, I should say. I continued in vet school, but during summers, during breaks, I was always going to physical therapy offices. I was getting educated in things like acupuncture, physical therapy, manual therapy. I spent time with osteopathic physicians to learn osteopathic manipulations. So that really became the thrust of what I knew I wanted to do with my career. And then when I graduated, the university said, well, this rehab thing really seems like it's taking off. So we'd really like to focus on that and build a rehab department here at the university. And so we'd like to keep you on and have you build a program, which was exciting for a new graduate. I thought, oh man, this will just be a no-brainer. This will be great. I think what was hard at that time is that not all of veterinary medicine was ready to embrace what a different paradigm it takes in order to treat patients who have arthritis, which is most of the caseload that a rehab practitioner will see. It takes time, it takes patience, it takes dedication from the pet owner. There's a lot that goes into it, and it's very different than a patient who comes in for a consult, gets a course of medication, and goes home well. That's why the CAM community has been built over these last 5 years with so much information, because it's not a one size fits all. It's not a, here's an anti-inflammatory medication, now go home and you should be fine. It's a road that has to be built one patient at a time. And so that wasn't a great fit for practicing that way in academia. So I decided, with much consternation, that really moving to private practice was a better fit for me. So I moved to a specialty hospital and worked there for 10 years. We built a nice rehab facility there, and grew to have it quite large, actually. And eventually it was purchased by a corporation. Corporations are steadily buying veterinary clinics in the United States. Some of them very conscientious about the practices they're buying, some of them not as conscientious. But the bottom line is, a corporation is there to make the bottom line work. And because rehab and integrative medicine are so different from other types of medicine or other ways of practicing in veterinary medicine, that it turned out for me to not, I didn't feel like I could practice the way I wanted to practice in that setting. So one of the other veterinarians I was working with there, and one of our veterinary technicians, the three of us left and said, hey, you know what? Let's build it just the way we want to build it. So now I've built 2 rehab practices. This is my 3rd try. 3rd time's a charm. Let's see if we can get this right this time.
I love it.
So really key is we kept our facility absolutely tiny. And it's really about knowledge, education, and hands-on therapies here. So it's very much individualized care. Every patient that we see gets a minimum of 45 minutes with the veterinarian that they see each time they come in, because that's what it really takes to evaluate what their specific needs are, and come up with that individualized plan for them. So that brings me to modern day.
Amazing. I'm going to put my earphones on and just see if that takes a little bit of that background, because there's just a little bit there, isn't there? Let's see if this helps.
Okay.
I love it. I've suddenly become an air traffic controller in like an instant. It's like Mr. Ben going into the fancy dress shop. So is that any better?
I can't hear the feedback anymore.
Okay.
Oh, yeah, I can, maybe a little.
Is that better?
Ooh, yep.
Okay. So we're now heading into the runway. Right. So I think you've made some really good points, because if you were actually to look at the NICE guidelines for human management of OA, right at the top is education and owner, like the owner of the illness empowerment. So as you say, that takes quite a lot of time. What we're going to do, we've planned this so that we can embrace everybody and everybody's situation, hopefully, into this live. We're going to talk about managing OA on a budget, and we're going to start low end and we're going to move our way up. And I'm going to be kind of posing cases to Jessica of how she would think about managing these cases. What are key points? So we're going to start off with low budget. And I'm going to make a case, and it's going to arrive at your clinic, Red Sage, Colorado, and you're going to start kind of spieling off all the sorts of things that would be straight off from what you would do. Okay, great. So first of all, we've got Jeff. Jeff is a 10-year-old black labrador. His elbows point out like that. He's got a massive mane. He's got this really rigid back. Coat looks terrible. Coat's going everywhere, this scurf. And his back legs have got a little bit of their own dance party going on when they're walking. So his front legs are kind of plonk, 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 and the back legs are doing a little bit of their sidestepping, bit of a wobble. And he comes in and he's quite out of breath, even just from the short distance to the car. So he's arrived at your clinic, and they're on a non-steroidal and they're now looking what else can they do. So what sort of things would you be suggesting? And these people have said, look, I'm sorry, I'm not insured. We really are going to have to be careful with the pennies. What kind of things would you be saying?
Great. Okay. So, Jeff, where I'd like to start with Jeff today is I like to think about things sort of from a 4-pillar approach. So we're going to start with the 4-pillar approach with Jeff. And within each category, we're going to mention a few things that we think are important. And then we're going to triage what's most important and what works best for both your financial budget as well as your temporal budget for Jeff. Meaning, how much time do you want to dedicate each week to Jeff? Because I think a really important distinction between maybe somebody who doesn't have time to educate a client as much as I do or have built into my schedule is they might say, well, gosh, here's what I recommend. And that's really the gold standard. And if you can't do that much, then I'm not sure we can help Jeff.
Yeah.
In the case of arthritis management, I feel very strongly that where there is a lack in pennies, if someone is willing to make that up with time and some dedication to their pet, we can always come to a place where we can achieve really good comfort and really good quality of life for that pet. So we'll still think of things in the 4-pillar approach, but within each of those pillars, we'll just triage to the top what we feel is most important to build into the budget from the financial standpoint.
Okay.
So my first pillar is nutrition and supplements. And you've mentioned that Jeff is a little bit overweight. So that's where we're going to start because it is, number one, the least expensive. And number two, probably has the biggest impact out of anything else that we will talk about today. And what I tell clients, sort of jokingly, tongue in cheek, but I want my arthritis patients to be supermodel skinny. So if you are getting snide comments at the dog park that your dog looks too thin, then they're probably just the perfect weight. And I think particularly with a furry Labrador or a golden retriever, sometimes I think we've really trained ourselves in our society to think that overweight is the normal way that dog should look. And what we understand is that actually keeping that dog at a lower weight is the most important thing we can do. So there are a number of studies looking at both elbow arthritis and hip arthritis and looking at just a weight loss plan alone with no other interventions can reduce lameness scores very significantly and reduce quality of life and activity level around the house. So getting calories off, taking calories out of the diet, getting weight off the pet is so important. And one of the things that I want to impress upon the listeners is I think everybody's brain just goes to, well, yeah, they have to carry around a little bit of extra weight, but what's the big deal? It turns out that the big deal is not as much the extra weight that patient is carrying around, but even the tiniest little bit of white adipose tissue, which is basic fat, is an active endocrine organ. And so you are secreting pro-inflammatory mediators or pro-inflammatory cytokines from that white adipose tissue. So if you are Jeff and you are secreting those pro-inflammatory mediators, they are going to those elbows that are already inflamed and just ticking them off. And we know this to be particularly problematic in dogs who have got knee issues. So we see very commonly ruptured ACLs or cruciate ligaments in the knees. And we know for a fact that dogs who are overweight have more of a tendency to rupture their ACLs and or progress to significant arthritis in their knees. It turns out that if you're overweight, you have more likelihood that progression is going to happen more quickly and more likely to happen in both knees instead of just one. It is probably not just the extra weight that's doing that, but that pro-inflammatory situation that is contributing to that progression. So I think it's really important to, not just go, oh yeah, let's get some pounds off so that these joints have less stress, but you're also changing the chemistry of the body by losing weight.
I love that. And I think just to plug a live that we did before with one of the coolest people I've ever met, Heli. I can't say her surname because it's Finnish and it means little owl. That's all I'll tell you. Her name's Heli.
Great.
And she did a a CAM talk about the changing kinematics of an obese dog. So there's very little out there looking at joint angles during movement of a standard weight dog compared to an overweight dog. Very few studies, but the ones that are there show that the range of motion through the joints is increased. So these joints are actually carrying more weight and having to actually go through their joint flow to a greater extent, which is not what they're designed to do. So you've got that as well. And she also dragged up some papers talking about how fat can infiltrate into the structural support of the joints, so tendons and ligaments. You get the lipid droplets, and it causes the weakening. So you've got increased range of motion, huge mechanical forces, less stability, and an inflammatory kind of blanket. So yeah, 100% weight. So have you got any tips of things that you just always say for weight loss?
Yeah. So, I mean, I think what's most important to me, there are prescription diets and there are ways to lose weight. But I think what I always impress upon people is if we need to do a weight loss program, the bottom line is I can do all the caloric calculations in the world, but we need to take calories out. And so now sometimes that can be scary because we worry that if we get the number of kibbles that a dog eats every day too low, they may not be receiving their baseline needs for other nutrients, vitamins and macronutrients and micronutrients. Mm. So one of the things that I really like to do for people is say, okay, let's just continue to cut the diet by about 10% every 2 weeks until we're beginning to see weight loss. And then once we see weight loss, we know we're at a good place. I think clinically what I see a lot is a really frustrating trajectory in the beginning, maybe 1 to 2 months of trying really hard to get this dog to lose weight and really not a lot of good or big gains, which can be so frustrating and disheartening because you have this dog at home who's telling you they're starving all the time. They're frustrated. You're frustrated because you're not seeing the weight loss. And yet you eventually get to a tipping point, usually between the 4 and 8 week mark, where all of a sudden the pounds begin to slide away. And once you get there, it's easier to continue on that trajectory. Now, there's probably a lot of reasons for that. We now know that obesity actually upregulates obesity genes. She may have talked more about that as well. And so, but clinically, it really fits that. Don't get frustrated in that first month or two because you will get there eventually by just continuing to cut those calories. The other thing I always tell people are green vegetables are your friend. So spinach, broccoli, sometimes dogs love to chew on broccoli stems or kale ribs or, anything that's a green vegetable, green beans. Those green vegetables are going to offer very few calories, but they're going to satiate the pet a little bit better. And they're also going to fill their stomach and, add to the micronutrients, the phytochemicals, the vitamins, all the things that the dog may be lacking because they're getting fewer kibbles.
Yeah. There's questions about diet and we will come back to them. I'm not ignoring you guys. There is a brilliant talk with Alex German on our YouTube channel talking about this. There is also a brilliant talk from Cecilia Villaverde. So if you want to know more about kind of weight loss structured plans, do go back to those lives because it is complex trying to keep it balanced, as you say, with trying to reduce those calories. And there are lots and lots of different ways for people that are on lots and lots of different diets. There is no one size fits all. But I do know, because I've been writing the owner module on weight loss for our new course, so I'm quite on it at the moment. So the University of Liverpool have their own weight loss clinic. So it's a specialist weight loss clinic. And when they reviewed their data, only 50% of their clientele ever hit target weight. Only 50%. And 50% of that 50% bounced back. So once they lost the momentum, the dog piled back on the pounds. So I think one thing I'd like to say is we're not looking at this as it's easy. I can't think of great words at the moment. It's a tough challenge to get weight off a dog. So don't think that we're trivializing. That's the word I wanted. We're not trivializing it, and we don't think it's going to be super easy, and it needs huge amounts of coaching, loads of pats on the back, loads of kind of whoop whoop, you're getting there, don't give up, we can establish this. And also for people to understand, once that weight is off, that might be you for life on a plan like this. So yeah, there's loads more about weight loss, so we'll come back to that. Right, next, Jeff. He's gone, okay, Jess, I'm on a diet. What now?
Yep. Okay. So everyone probably knows there are loads of supplements out there, and you can sign up for a subscription, or you can pay $200 a tin for the latest and greatest glucosamine and blah, blah, blah supplement, green lip mussels, whatever it is. The truth is, this is not a place where I usually triage people's money if we have that low budget case. There are glucosamine and chondroitin supplements that can be purchased over the counter for very inexpensive. But over and over again, there has been very mixed responses from dogs, horses, and humans to glucosamine and chondroitin supplements. There's even some postulating now that maybe the glucosamine or chondroitin never actually makes it to the joint, but maybe changes the inflammatory milieu in the gut. And maybe that's why some people feel better on a glucosamine supplement. But the bottom line is, this is not a place where I have people spend a lot of money. There are, if they've got a huge budget, we can come back to this later. Maybe there's something we choose from this category, but weight loss is really what I want to focus on in my first pillar for Jeff.
High five. Okay. Okay, next part.
So my second pillar are pharmaceuticals. And working in an integrative medicine practice, I have a lot of clients come in who say, no pharmaceuticals for me. And I say, wait, let's hang on one second. Because where pharmaceuticals really come into play for me are making sure we have this pet comfortable enough to do some day-to-day activities. Because as we have them losing weight, and we're going to talk in the next pillar about getting them to do some exercises, I want them to be comfortable enough that they can have relatively normal body mechanics. Because if they can't, we're just going to cement patterns and pain patterns that aren't going to be beneficial for this dog long term. So we do have a giant array of pharmaceuticals that we can use that are safe, inexpensive, and can do a really good job of getting us to where we need to be without spending a lot of money or putting the dog's health at risk. So Jeff is coming in on an anti-inflammatory medication, which is fine, and probably the one medication that will make the biggest single impact on a dog's overall comfort improvement. So it makes a lot of sense that a general vet would see a dog, say, oh, you have arthritis, you look like a mess, your elbows are terrible, here you go, why don't you take this anti-inflammatory home with you? And by gum, within 2 or 3 days, the dog will probably be feeling better, playing more in the yard, getting up more easily, going on walks, maybe going a little further. However, anti-inflammatories are often my last reach, because we do know that they can come with some health impacts. So I think about the gut, I think about the liver, and I think about the kidneys when I'm starting an anti-inflammatory. And there are many of the other medications who I don't have to think about internal organ health. So I might reach for something like gabapentin, which probably won't be as effective for these arthritis patients, but might give me enough comfort to get them exercising well, get them going for their walks. Maybe they go down to the river or the lake and they go for a little swim, and I can get them there with gabapentin or amantadine, some other medication. I also branch outside those sort of mainstream medications when I have pain that's a little more refractory. And boy, Jeff with his elbows are tough. Elbows are not a forgiving joint because they're such a tight hinge joint. So, once in a while you'll see a dog with hip arthritis, and boy, the hip looks like cauliflower on an x-ray.
Still good.
Whereas a tiny little change in the structure of the elbow radiographically can create a lameness that's really profound. And so the elbows are a place where we're going to want to be as aggressive as we can from both a pain management standpoint and our overall approach, because we know how unforgiving they can be and how much chronic pain they can cause for the patient who's got especially bilateral bad elbows.
Elbows are really fascinating because, as you say, they can be really, really super sensitive for what looks like not a much change. But then they can seem to go through a phase where they become quite stoic, you know, and you have these dogs that have got elbows that are seriously going out like that, and they get on with life. And it's always bilateral, so no one notices that they're actually lame. And then suddenly, bam, it hits them again, really flat in the face. And you're like, God, I am dealing with a mess, you know. And they just, no movement. They're just peg legs by that point, aren't they? Oh.
Yeah, I think that's where Jeff is.
Just peg leg.
Yeah. So I think we're probably going to want to do some additional pharmaceutical management on Jeff. So maybe what I would try, and the anti-inflammatories also tend to be the most expensive of the medications. So what I might try with Jeff is, let's say, okay, let's layer in some gabapentin, maybe some amantadine, maybe even something like low-dose naltrexone for Jeff, which is a medication that's going to be inexpensive, safe, does probably need to be compounded by a compounding pharmacy. But what it's going to do is alter the way his nervous system is dealing with the pain from this chronic elbow arthritis. And if we layer in all of those things into our pyramid, then what we can do is probably take back that anti-inflammatory a little bit. And we know with anti-inflammatories that side effects are dose dependent. So if we reduce the dose by 25%, maybe even 50%, because we've added in these other medications, we're actually going to end up with a safer situation, and we're probably spending less money because the drugs we've added in are less expensive than the anti-inflammatory, and now we're going to take that back.
Over here, sadly, amantadine is very expensive.
Yeah.
So over in the UK, currently, neither of them have got like a veterinary license, so they're human generics. And
which is what we use here too, actually.
Yeah, so gabapentin is pretty cost effective. It is a Schedule 3, so you can only get a month at a time, so people don't go home and abuse it. Amantadine is more expensive. So if I buy a bottle of amantadine syrup for my cat, it's £350. 150. I was like, Derek, you can't have much of this. Yeah, have more gabapentin, less of the amantadine.
Right.
But yeah, so they're quite expensive, but there are alternatives over here. So we've got memantine. So some practices are now using that. And we've also got pregabalin that a lot of people are using because it's a little bit more predictable, a little bit more stable, maybe less side effects, a bit more bioavailable than gabapentin.
Yes.
So cool. Okay, so we've done like a pharmaceutical. Now what's next? What's up your sleeve?
Okay, so the third pillar is really my favorite, and it's what I do in my practice a lot, but it's also, there's very much of pillar 3 that can be done at home. So pillar 3 is what I call physical medicine. It's anything that's applying a physical force to a joint or a muscle or the musculoskeletal system in general to achieve an outcome. So this can include walking, stretching, therapeutic exercises, which include more like the things you would do if you went to a physical therapist or a physio. They would be teaching you how to strengthen your hamstrings or strengthen your triceps specifically. And this is an area that's really fun, I think, for physios to get into in the veterinary world, but it's also something that can be done quite easily at home. And really, I mean, if you get creative with the exercises that you want to do with your dog, it can be sort of like training an old dog new tricks, which can be really fun and rewarding for the dog. It's helping engage their brain, which is a really important aspect of this as well. Well recognized in humans that maintaining a positive outlook and maintaining some activity not only help with the pain management, but also help with some of the depression and things that go along with that on the human side, and we really see that mirrored in dogs as well.
Yeah, and I think just to add in, because I've been doing a few cases recently and trying to get people to break habits. That's really hard, isn't it? So I've got a few people that they have a routine. So the walk is their routine, and it's their downtime, it's their relaxation time, walking the dog's off lead. They might phone the friend, they might just kind of get their head in order. And it's really hard to let go of that and replace it with something a bit more constructive. But once you break that habit and you bring in that new way of thinking, I'm going to target some activity that's beneficial, break the routine, introduce it, just nail it, keep doing it. Suddenly it becomes second nature and you start enjoying it. I only put that in because we're so busy as people, aren't we? We're so busy. You know, you're on your phone, you're dragging the kids with you, you're going to go to the post box at the same time, the dogs come in, you're going to collect the shopping, and you try and bin it all into 120 minutes. Yes, you do need to kind of like take the advice of people like Jessica and go, right, okay, I've got the understanding, I get the principles, now I've got to integrate it into my day, because they've got to be done regularly, haven't they?
They do. But the caveat I will say is, I think, you know, people will say to me, my gosh, I can't make it to the gym myself, let alone do a workout for my dog, you know, and I get that, I hear that. And doing the workout yourself actually is important. So I don't want to take away from that time. I think what I've really been impressed with over the years is I do think dogs have a better capacity for athletic function than we do as humans. So, you know, your physician might say to you, well, it's not worth doing unless you do 30 minutes of exercise 5 days a week. Well, okay. In dogs, I mean, I really have seen dogs who can do 5 to 10 minutes, maybe even only 2 or 3 times a week, and have a giant impact in their quality of life and their ability to exercise in a more appropriate way. And then instead of seeing a vicious negative cycle, we begin to see a positive cycle of they feel more comfortable, so they're able to do more on their own. So then they get stronger and then they get more comfortable. So what I really try to tell people is, hey, okay, maybe you want to target 10 minutes 5 days a week, but in reality, if you only get 5 minutes 3 days a week, don't
Still
give
worth
up.
doing.
Don't just stop doing it, because you will get some positive impact out of that.
Yeah, definitely. And again, I am going to be totally blatantly awful and plug the course that will come out soon. It's a ridiculously cheap course. It's going to be about 25 quid. It's 12 modules. It's for owners, and it funds CAM, because we don't have any sponsorship. This is all kind of self-created. And in it is my lovely, very sadly missed Holly, and using interactive feeding situations to get activity. And there's one video that I've left the voice over in it, because I'm going because she is doing downward dogs, and she's flexing and extending, and her neck's bending, and she's pushing her weight back. It's forward, it's back, it's forward. It's like watching her doing a bit of a calisthenics session. And all I did was put the food into the toy and put it on a non-slip rug and go, do it. And it was it's things like that are so easy to integrate, isn't it? It's just think about it, plan it, implement it.
You start to think of all kinds of creative ways then to encourage this type of strengthening. So, you know, maybe if you have a nice set of carpeted stairs and that's not too much for the dog yet, you invite them to come up and down with you, and you help them go nice and slowly so they can control themselves. Or maybe you take them on a ride to the grocery store so that they can do a little bit of balance work as they look out the window. You know, you really do start to think of things that you can incorporate into their everyday life that help them maintain a better ability to maintain not only strength, but also balance and flexibility are really important here. And we know that to be true for geriatric humans, but also for our geriatric veterinary patients.
I love that. I'm going to do a little tangent again. I'm just going to show off a little bit. Ready for the show off. So I paddleboard a lot. It's like my absolute zone out. And I've always done it with my dog on the board. And Holly, the previous dog, she had terrible lumbosacral disease, like horrendous. You know, when you see that horrific bridging and you're like sclerotic mess. And somebody once said to me, you know, she really actually should be a lot worse considering what we're seeing on MRI and X-ray. And I think it's because she paddleboarded with me so much. She had quite good core, because if you think about a board moving in the water, it's forward and back, a bit of a wobble, forward and back. So she was on a balance board for like an hour a day, 6 times a week.
It's lovely. It's lovely. And we here in Fort Collins, Colorado, have a reservoir here. And so people love to paddleboard. And it is actually one of the homework assignments I give them is
No
the
way!
dog, teach the
Oh
dog
my
how to be
God.
on a paddleboard with you.
I'm going to start that school.
Yeah,
The
totally.
Arthritic paddleboarding school for
Yep.
dogs. I
Yep.
think it's niche, but I think it could work.
Oh, it could work. Absolutely. No, I think it's really great. And so, you know, I think getting a little creative and finding fun things in your life that the dog could incorporate in are great. I mean, I even have people do things like if they live in town, they're walking up and over curbs, just to add in a little bit of variance in the dog's substrate that they're walking on to help them just integrate some of that ability to feel different surfaces, which are often lost when you lose muscular function due to arthritis. So, okay, here's my little bit of a tangent. I think I want to just tell a little more about why balance is so important as patients age, and particularly after they've had an injury or as they begin to develop arthritis. Whether you have something like lumbosacral disease or spinal stenosis, and that's pinching on either the spinal cord or the nerves, or you have arthritis in a peripheral joint, one of the things that we know happens is, yes, you have some muscle atrophy, but at the same time, you also lose muscle proprioception. And we know the nervous system does some proprioception, but muscles are actually quite good at proprioceptive activity. And proprioception just means the ability to feel where you are. So when Holly was on that paddleboard and she felt the little wobble, it took proprioceptors to be able to recognize that. Mm. In the case of muscular proprioception, whether you're overusing a leg because you're limping on your other leg, or you're underusing a leg because of an orthopedic or neurologic injury, losing that muscular proprioception means that you are now prone to injure whatever is hurt already more and again because you've lost that proprioceptive function. Mm-hmm. And so working on just a little bit of balance work every now and then is really, really good, because when that older dog is now out for a walk and they step off the curb, or there's a hole that they didn't see and they step into it, their muscular proprioception should protect that elbow by a quick movement to change direction. And that's all done on reflex. Mm. As you start to lose that muscular proprioception, you lose the ability to do that. And so instead they step in the hole, they hyperextend the elbow. Now they inflame that elbow and hurt it even more, and it's already a mess. And so now you've got sort of insult to injury.
Yeah. And that's probably the easiest thing to integrate into your daily life with your dog. Just the little weight shifting, shunts, pick up a paw, these sort of things. And I so wanted to do this live with you because I just knew that people were like, oh my God, all the freebies. There's so many freebies in your toolbox that people aren't aware of, are they?
Yep.
Yes. Okay, so onto your fourth pillar.
The fourth pillar is what I call regenerative medicine. And I think this is really in vogue, and stem cells are always the first thing that come up in this category. The truth is, I don't use a lot of regenerative medicine, especially as a first line. So for example, for Jeff, we've got lots in pillar 1 through 3 that we're going to work through before we get to pillar 4. Mm-hmm. What's included in pillar 4 for me is platelet-rich plasma, stem cell therapy. And what I use more than anything else, and I don't know how available this is in the UK, but extracorporeal shockwave therapy is something that I use really, really frequently. And the technology has gotten good enough. It used to be a very painful therapy, and so dogs had to be sedated in order to receive it. Now, the technology has gone to using piezoelectric crystals, which are the same type of crystals used in ultrasound. Diagnostic ultrasound. Now those crystals are used for extracorporeal shock therapy, and we use a lot of that for our arthritic patients if we can't get anywhere with the other 3 categories.
Yeah, it's becoming more known over here in the UK. And yes, there's the 3 different kinds. If you've got your electrohydraulic, piezoelectric, and I've forgotten, electromagnetic, isn't it?
Radial. Yeah, it's like a pneumatic.
Yeah. And I think a few practices have it. We had a brilliant live with Professor Matthew Allen from University of Cambridge, and they were doing a study on elbows with it. And he was working with Dr. Kiki Hausler, who I'm still trying to pin down. Kiki, you still have to come on a live. So we will do more about it. And I think I'm like you. I think it's going to be really exciting because it's totally possible to do it, conscious with some machines, but even if you do have maybe one of the electrohydraulics like the PulseVet, you can incorporate it after the x-rays. So if you've sedated a dog for x-rays and you're like, right, well, it's sedated, I can do something now. Wow. And it's mixed tissue as well, so you can be using it for your tendinopathies, you can be using it for your myofascial problems, you can be using it for your joints. It's really quite exciting, isn't it?
It's probably the technology in the last 15 years that has changed the game for me more than any other single technology in terms of actual patient outcomes.
Wow. And is it expensive? Could Jeff's parents potentially afford it?
So here's what I would say to Jeff's parents. When we triage funds, so for us as a veterinary hospital, it's an expensive unit to buy. However, now because we don't have to sedate the patients every time, it becomes much more cost effective for the clients because they can come in and just have that therapy. So what I tend to do is triage down, okay, I'm going to have you do all of these exercises at home. We're on a weight loss plan. We've got a good medication plan down. So we're not really spending any money or very little in those other categories. And so here it's about $160 for a treatment. And we usually space those treatments about 1 month apart. And we usually do 3 treatments. So that is something that most families will say, you know what, I'm willing to save up for that. Or I'm willing to drive, I have clients who drive from between 1 and 5 hours away to come in and have a shockwave therapy once a month because it makes such a big difference. And it's the thing that I can do here that will give them the most longest lasting benefit when they leave. If I'm doing laser therapy or if I'm doing acupuncture, those things are helpful for the pet, but usually only for a day or a week or maybe 2 weeks. Whereas if they're having shockwave therapy, we're seeing much longer term benefit for those.
Amazing. You actually answered a couple of questions. Somebody says, how about the benefits of bodywork and massage? So let's have we got time with Jeff that we're going to just talk about a bit of manual therapy before we find Mavis? Mavis is our next dog.
Okay, well, actually, I think probably if I'm being realistic and I want to keep that budget really tight on Jeff, I think we've done what I want to do on Jeff.
Okay.
And I think for Mavis, maybe we're going to use Pillar 3 to do some manual therapy and body work.
Okay, right. Okay, so Jeff's gone home and he said, thanks. I really love you, Jessica. You're great. And then Mavis pops in, and Mavis is, she's a 15 kilo kind of mixed breed terrier. She isn't carrying any weight. She's a little bit feisty. is Mavis. And again, she's got quite a roached spine, so it's very fixed. She's got a really big lumbar apaxials. They're solid. She's got quite a thick neck, and she feels like her shoulder blades are up here. So she kind of turns around like this now. And you can't really work out where she's lame because she's got short little diddly legs, because you always go, where are you lame? You're just a moving blob, aren't you? And so she's had arthritis diagnosed in hips. She's got spondylosis, and she's got elbows. So let's do the common ones. And they've come to you and they're not on anything, actually. So the lady is really into, as you say, trying to avoid pharmaceuticals. She'll take your advice, though. And they are insured. So you've got a bit more to play. And they live around the corner, so they're not too far away.
Great. Okay, so I'm going to use that same 4-pillar approach. And our first pillar is going to be nutrition and supplements again. Now, in this case, we don't have to work on weight loss, so we can maybe spend a little other time talking about other things. I find that a lot of people interested in integrative medicine are really keen to add something to diet. Usually they're on a diet that they like. I'm not a nutritionist. Nutrition is not my specialty. However, I do find that people really enjoy adding things to their pet's diet. And so as long as we're within a safety margin, I am fine with people trying some things in this category, whether those are manufactured supplements, or I have some people who like to make a turmeric ginger black pepper paste and put that on their dog's food. So as long as they are being safe and they want to try some anti-inflammatory things, and Mavis might be a good candidate for that because she's got arthritis in a bunch of places, but nothing so severe that I think we need to really jump down the pharmaceutical pathway with her. She's managing okay right now with not being on anything. And so maybe supplements are a better place to start with her. So, I'm just trying to think of what we really want to prioritize here.
I've just given you a bit. She's a bit.
Oh, right. Yep.
So I'm just trying to give you a tip that maybe you need a bit hands off first.
Yeah. So the other thing that I'd like to just mention here is I do use a lot of polysulfatic glycosaminoglycans. Do you have an injectable?
Yeah, so we have Cartrophen over here. So you guys have Adequan, and we have Cartrophen. They're not the same. They're friends, but they're not the same. And you do it, I think, every 3 to 5 days for 8 or something like that, and we do it once a week for 4.
Okay.
And I think I don't know if you have the same issues over there where people start using it monthly. So there's a real tendency over here for people to start using Cartrophen on a monthly basis, where it's really designed to be given once a week for 4 weeks, up to 3 times a year. I don't know if it's the same with Adequan. Do you give it in a block?
It's the same. Yep. It's labeled for twice a week for 4 weeks, and then really that's all it's labeled for. And people do use it on varying other schedules, but that would be off-label use.
Same here. Yeah.
So that is one thing that I sort of put into this supplement category, even though it's actually a medication, because anything that's injectable, at least here in the US, needs to be FDA approved as a medication. But as a gag, the protein that makes up joint fluid and cartilage, it's really better labeled as or thought of in my mind as a supplement. With very few side effects with it. So that is something I might consider. And I might consider for this gal, though, being a little bit, I'm not sure if a sub-Q injection would be okay for her.
Oh, you're going to get away with that. You're going to get away with that.
Okay. Yeah. So maybe we'll sneak in some Adequan, with particularly thinking about her elbows and her hips in this case. I find that it can be a little bit helpful for some of our spinal patients, though I don't tend to find it making a huge difference for those spinal patients. And so maybe I'm reaching for other things for the spinal patients.
And with your use of Adequan, so I've found with using Cartrophen, it's either going to work or it doesn't. And if it doesn't work by the 3rd of the 4 injections, if I really am not seeing benefit, I do shelve it and start really investigating other options. I don't kind of keep spending that part of that person's budget on it. I'm like, let's see what it can do. Okay, we have got other tools. That's fine. Yeah. Is that the same, or do you kind of go, no, you're going to be on this for life? This is your background.
No, I think it's very much the same. And I would say that's actually true of almost all the supplements that we use, because they tend to be expensive, more expensive in many cases than the pharmaceuticals. And I think it's easy to add on things. And suddenly you're spending $500 a month just on supplements.
Oh, yeah.
And so I like people to try one thing at a time. The exception to that would be the dog that comes in and is in really bad shape. And the client says, I want to do everything I can. And then we throw everything at them, and then we take away one thing at a time.
Yeah. So that's like a lot of people do kind of, there's so many different ways to manage this disease, guys. And that is another approach where instead of adding one thing at a time and going, what's going to work, we consider the welfare of the dog and go, let's add everything. Yes. And let's slowly take things away. And that's totally fine. It's okay. I think sometimes on Holly's Army, people go, what are you doing? You're like, they're always going to be different, aren't they? The plans are always different. They suit the dog.
Yeah.
Okay, so what's her name? Mavis going, come on, Dr. Jessica, what you can do for me?
Yeah. Okay. So there we go. There's the supplement category. I think in Mavis's case, I'm hearing more of a spinal component. And so even with the supplements I'm choosing, I'm going to lean more away from the glucosamine true joint type supplements. And I'm going to lean more towards things that might penetrate the blood-brain barrier and give us some benefit in any impinged nerves or the spinal cord. The list of those things is relatively small and includes fish oil and probably curcumin, as long as it's a curcumin that's bioavailable and is actually making it into the gut, which is why people add black pepper to the paste that they like to make at home, because black pepper does seem to make turmeric a little more bioavailable.
Okay. Yeah. And I think the only thing, so over here, there's definitely 2 schools of thought with turmeric. There are the people that it works, and then there's the people that go, there's absolutely no clinical evidence. And we talked about this before we went live. Cam tries to be very evidence-based, but we try not to put on the blinkers to other options. And there is definitely many people saying, if there's no evidence, it doesn't mean there's no evidence. It just means there's no evidence now. With turmeric, it's a bit difficult, isn't it? Because there is quite strong evidence that it's not very bioavailable. And there's a lot of people plugging in loads of turmeric powder where I think it's about less than 1% is likely to be of any benefit whatsoever. So we were chatting and we found that the middle ground is try it, but monitor it, guys. Don't keep plugging things in if you don't think it's working. Yeah?
Yeah, and I think the downsides of turmeric are it can cause some GI upset. It can cause some vomiting and some diarrhea or just an uncomfortable stomach. So that's one of the things I really have people look out for. And so that's the primary downside of it. And we do have some supplements here in the US, one in particular where it's combined with some phosphatidylcholine that does seem to make it more bioavailable. And we do have the data on that. But the other thing I would say is I don't find it makes a huge clinical difference for my pure arthritis patients.
Right.
And really, I think the better data for turmeric is looking at, unfortunately, like settings where there's been really significant spinal cord injuries.
Right.
And so the spinal cord aspect of this is what's biasing me towards, let's give turmeric a try. Whereas in Jeff, even if we could find an inexpensive turmeric option, I'm not sure I'd reach for it because he was purely kind of an elbow guy. He did have some spondylosis, I think. But I didn't hear as much spinal cord involvement or potential with him, which is why I'm really reaching for that one here.
Yeah. With regards to side effects, just the practical nature, guys. If you have white furniture, it's a no. If you have white carpets, it's a no. It stains.
Yes, it does.
And they get it all from their mouth, and it's in the saliva. Stains. So, but yeah, and I think the fair thing to say, because there's going to be a lot of people that are very, very evidence focused here that will go, "Whoa, Cam just said turmeric," as much as people that say, "Oh my God, Cam didn't say turmeric." There are so many people that have a very polarized approach. I think a very level-headed situation is to see this in a biopsychosocial matter, which is considering the owner's wishes, understandings, beliefs, culture, as well as the dog's needs. If you can fulfill both and it's safe, and then it's being monitored to see whether it actually works, it's quite a nice middle of the road way to be. And that's kind of my approach. If it's within that person's belief, it's in with they've seen it work on another dog or a friend's dog, okay, let's try it, as long as it doesn't upset the apple cart with regards to other very relied upon interventions.
Great.
Amazing. Right. Okay. So what next?
Okay, so pillar 2 is pharmaceuticals. And I think I've heard from these people that maybe they don't want to reach for pharmaceuticals first. That's actually okay with me. As long as I feel like Mavis is moving well enough that we're going to be able to engage her in pillar 3.
Okay.
The one thing I'll say about pharmaceuticals for Mavis is I do what I call a refrigerator plan for these clients. So I'd like them to have a little emergency kit and a little plan laid out on their refrigerator for when Mavis has a setback because of her arthritis and she's suddenly having a pain episode and it's Friday afternoon at 4 p.m. and no veterinarians are available. I want her to have a little kit at home to help her get through the weekend comfortably. So I'll just send a little envelope of, maybe some anti-inflammatories or maybe even some gabapentin, which can help in an acute situation with a spinal cord impingement. If we have a bulging disc or an arthritic facet joint that starts to impinge on the spine, using gabapentin in that type of setting can actually really make a difference. And so they're going to go home with a refrigerator plan.
I love that. And that actually is a really good point, because when you read about acute flares in humans, a lot of physicians talk about having a baseline plan and the acute plan. So they do say to their patient, you're going to do this. Yeah. I can't stop that. That's going to happen. So I've got a plan for here and I've got a plan for here. And here, as you say, is your fridge kit. Yeah. Brilliant. Love it. Yeah. Okay. Keep going.
Pillar 3 is going to be where we're going to include things like acupuncture, manual therapy, but Mavis is a terrier.
She gets nicer when she gets to know you.
So here's the thing. We have our clinic set up like a house. So dogs come in, they take their leash off. I don't force them into the room that they want to be in. We do use a lot of food rewards to make it a positive situation. And so what I find is I'm able to win over, even the big, mean, scary police dogs or the terriers who are just not interested. So 90 to 95% of patients can sort of be won over and teach that acupuncture is actually a really comfortable thing. And I'm quite focused on acupuncture and maybe a little bit of manual therapy for this dog because in particular, I hear that her neck and her apaxial muscles are really overdeveloped. And that is a sign to me that she's overusing those muscles. And I want to do something to get those muscles to relax, to calm down. A tight muscle is actually not a very functional muscle. And so what it's doing is it's overprotecting, but it actually becomes less effective in protecting that spine because it's just engaged and overdeveloped all the time. So what we're going to do is use some acupuncture, maybe some massage, maybe some manual therapy to calm things down in there. And once we calm them down, now she's going to go into her exercise plan with the ability to execute those things more appropriately and use all of those stabilizer muscles along her spine in a better, more appropriate way.
I like it. And as you say, because they live around the corner, that's kind of like doable, isn't it? Because those are interventions that it isn't a case of, there you go, see you in a month.
Yeah.
What about laser? Do you use much laser?
Yep. So good question. I think laser is very much in vogue in the veterinary world, at least here in the US. Almost all our general practices now have lasers.
Everybody's got a laser.
Yep. The thing is, they're very expensive to buy. And so when we opened Red Sage and we wanted to do it on a budget, we said, you know what? We're not going to spend all that money on a laser. So does laser work for arthritis patients? Yes, I think it can help with pain management, but I think it's a short-lived analgesia, which is why we decided to buy a shockwave machine instead of a laser.
Right.
That said, we are able to work with a company here who can drop ship both lasers and there's like some little LED lights and stuff that people can use at home quite safely. So low-level lasers and LED lights are what people tend to use at home. And I feel the benefit of laser that I was getting from the lasers was not big enough for me to spend my I'm going to call it precious time. Not to say, whoa, I'm so great, but if I'm going to be doing something, I think I'm better off using my hands or doing acupuncture, something that can't be done outside the clinic. And in this case, some light therapy can be done outside the clinic and can be done in the home setting. And so we've decided from our standpoint and our business plan, the way we want to spend the time with the patients when they come in, we feel like our time's better spent.
And I think that's good. And I think what people have to remember when they watch these lives, this isn't the world's University of Arthritis, the pinnacle way to do it, the only way to do it, a set protocol. This isn't a Cochrane review of canine arthritis. This is, we get an amazing opportunity to interview really cool people from around the world of how are you doing it and what works for you. Because what I do isn't going to be the same as what you do and what somebody else does. You know, can we name drop Robin Downing here? What we do isn't the same as what Robin Downing does because we want to interview her. Right. We all do it quite different, but it's all being very responsible that our intervention is effective, because at the core of everything is the dog, and then around the dog is the owner, and they have to be what our focus of attention is. Is it working for them?
Yeah.
With your home care with cold level laser, low level lasers and LED, it's always a contentious issue. It's always very contentious. What do you use it for? Because there are a lot of products on the market, and don't get me wrong, I look at a lot of them going, oh my God, is it true? Is it not true? This is a lot of money as a one-off payment. What kind of things do you use it for?
I think the places I can't live without laser are wound healing in particular. And sometimes we see these old arthritis patients who have, scuffs on the top of their feet or so.
On the elbows.
There's a real benefit for wound healing. And then I think the other place I really like it is a dog whose pain we can't get under control, whether that's because we can't use pharmaceuticals or we have maxed out our pharmaceuticals and we just need another thing to add on. It's a really nice way, and a really nice way for that client who says, you know what, time's no issue. I want to spend my whole weekend with my dog and I just want to do something to help them feel better. That's a great client for home laser use. And I will say I had 3 $60,000 class 4 lasers in my previous practice. And I think there were some real benefits for some of the patients who received that laser therapy when they were there. So, I think this is another place, sort of like the turmeric thing, where I'm going to take the middle of the road and say, it's very individualized if a dog has a positive, beneficial response to laser therapy or not. And I really want the pet owners' input on whether we think we're seeing a clinical difference.
Yeah. No, and I think that's fair. And I think that goes back down to objective monitoring, so when you have your first assessment and the start of your plan, get your objective monitoring. Where are you? What are you going to see? And talking about non-steroidals, one of the benefits of non-steroidals is you can actually say, where can I get to? Because non-steroidals work quite quickly. They give the owners quite a lot of hope. You can see a dog go from pretty damn awful to, oh my God, that's a quality of life. And if they want to step away from them, I say to them, well, that's the level now we've got to reach by using everything else bar. So how do you, as long as you're cool with that, but if we're not reaching there with everything else bar, then can we chuck them in again? Because I want to be there. And that's where the dog wants to be as well. He wants to be up having a great life. Cool. Okay. We've got loads of questions and you're going to have to come back because you're great at this. And we've still got to talk to a few other dogs, such as Alfred, Jerry. There's going to be loads of them. But we've already hit an hour. So I think what would be fair to you, because I know that you're at work, is let's get you back and talk again, because you're fantastic at this. And it's so human. And I think people can totally relate to you that we actually feel like we're in your clinic. We feel like we're talking to you about cases. And I hope people can understand there isn't a set protocol for every dog. Every dog is different and their owners are different and their situations are different. And we're looking at ways to improve the quality of life for all of them. So we're going to finish off with our 10 top tips. Okay. I also want to get you back to talk about LDN, but that's another thing, because no one's talked about that on here yet.
Oh, great. Yeah.
And also because I fell in love with you when you were talking about doing ketamine CRIs. So I'm going to get you back for that too.
Yeah, great.
Okay, so 10 top tips. I'm going to start with number 10. Rugs. It's always rugs. It's rugs. It's rugs. I'm a flooring specialist. I absolutely believe more rugs, less drugs. It's obvious. It's so incredible when you start putting down tractional flooring. Their pain state drops. Their anxiety drops. Their muscle tension of I don't want to slip drops. They start moving better. They're much happier. Put your rugs down. Number 9.
Movement. So just because they look more sore doesn't mean you want to let them lay there. Get them up, get them outside, let them sniff the morning newspaper, just take them to the mailbox and back if that's all they can do. But short, frequent, mild to moderate intensity movement.
Love that. So I'm going to add to that in my interactive feeding toys, licky mats, snuffle mats, Kongs. Even if you get a cardboard box and you wrap up tiny little pieces of food in paper and you put it in the box, and they're walking around the box, they're leaning forward, they're leaning back, they're leaning forward, they're leaning back. And Kongs, digital OA, they put their foot on the Kong to stabilize it and their toes go around. They start bending their toes. Yeah. Fantastic. Yes. Okay. Yeah. Number 7. I get really excited. Can you tell?
Okay. Oh, that was number 8. Okay. It's back to me. Number 7.
Yeah.
Make meals and treats. Always working for meals and treats.
Yes. Yeah. Make them work for everything. I love that.
Yep.
My favorite thing that I did with Holly, which I think is awesome, we're still on the food thing and the moving. Hopefully people have seen Holly doing the pickup sticks. So it's a little bit like Cavaletti's with scenting, where you get a load of tree branches. They're all about kind of that thick. And you just throw them up in the air like the old pickup sticks. Do you remember that game where you're the sticks, you throw them in the air and you have to pick each one off? And they land in a really irregular pattern. And then you throw a handful of food into that and they have to step around and they're twisting and they're balancing as they try to get bits and bobs. It's a total entertainment centre with lots of physical and mental activity, very little food intake. So it's good for dogs that are dieting, and it keeps them busy for 20 minutes, half an hour. It's fantastic. Okay.
Okay.
Number 5.
Number 5, teach your dog to walk backwards.
Oh, yes.
Yeah. So walking backwards causes a contraction of the gluteal muscles and the hamstrings at the same time. You get hip extension, you get stifle extension, and hamstring and gluteal strength is one of the things we know really protects the knee and the cruciate ligament. So great whether you've got a dog with arthritis or cruciate tear or somewhere in between, or you're trying to prevent it. Teach them to walk backwards, even from the time they're a pup.
I like that one. Number 4 for me, I want everybody, so there's 150 people that have been watching it at the moment. It went up quite high. For the 150 people that are listening now, I really want you to go and look at your dog and look for their waistline. Okay, because it's always brought a laugh whenever I was doing owner workshops. Take your eyeballs out, put them back in, pretend the dog's not yours, look again, because 9 out of 10 owners of overweight dogs can't see it. They're happily oblivious to the fact that their dog no longer has a lean fighting machine appearance. So take your eyeballs out, put them back in, look at your dog. Be cruel to be kind. You will get years longer of bearable, pain tolerable life. I'm not going to say pain-free because that would be lying, but it makes a massive impact. Number 3?
Number 3, think about what your refrigerator plan would be. So what would your refrigerator plan be with the tools you have on hand right now? And then your next step might be to talk to your veterinarian about what additional medications you need to have in your toolbox, or if you've got room to move on your medications. But sometimes your refrigerator plan might be a massage or, something else that you can do at home easily. So think about what tools you have in your home and what your refrigerator plan would be.
I like that one. Number 2 for me is about keeping them warm. So I see a lot of dogs, and you can see that they've already got a huge amount of muscle tension. You can see their posture's really adapted. They're just holding themselves together. And I've got a bad back at the moment. And if I get a cold, I feel myself doing this even more, and an ache sets in. Have you had that, where you get this low-grade ache, and you're like, oh God, this is really unbearable now. So if your dog will tolerate it, because choice is important, and some dogs that, especially if they're double-coated, they really don't tolerate more temperature. Think about keeping them warm, and that might even be at night. You put on a little kind of a rug, a little coat, so that in bed they can really get toasty. I've been sleeping with the electric blanket on for the last few weeks. It's fantastic. So keep them warm. Number 1, the biggie.
Number 1, this is my biggie. I saved it for last. Learn what signs of pain are in your dog. So that you can advocate for them when they're getting uncomfortable. So don't just look for a limp, but touch them. Figure out if they twitch when you touch their lower back. Figure out if their arms are sore, or if it's uncomfortable when you bend their elbow. Get your hands on them to see if you can figure out what some other signs and locations of discomfort are on your dog, so that when they have a setback and you're wondering how aggressive you need to be about managing it, you've got some tools that you can look at to determine how painful they are and if you
love that more. There is and hopefully one of the ambassadors, which we'll put it on the side, we've got a tool that you can download from the website called the Chronic Pain Indicator Chart.
Great.
And you choose 5 things that have changed for your dog: change in movement, change in behavior, change in capability, and you choose ones that you logically think, if the pain state decreases, that can come back. So a typical one not to do is, if you've got quite a debilitated dog that no longer does the stairs, don't wait for them to start doing the stairs, because we don't want them to be doing the stairs. Okay. So you pick 5 things and you look at their overall happiness. So you take their mood into account and you look at their overall mobility, and you can chart it, and it's free of charge on the website. And if you find that a little bit hard to do, there's a very simple one called the Good Day, Bad Day Pain Diary. And it's just a sheet, the days of the month, and you can tick when it's a good day and you can cross when it's a bad day. If you want to be clever, you can divide it into morning and afternoon. Good morning. If you want to be really smart, you can divide it into 3. I don't mind how you do it, but it means that you can start tracking what is working and what isn't.
Yeah, great.
You are amazing, and you are coming back because you've got so much to share, which is fab. And I love meeting people that you can feel they have that same passion about it. And as soon as you said to me it started at uni, I felt most guilty. Mine started 10 years in, so I'm way behind you. But thank you so much. It's been an absolute pleasure talking to you. Thank you very much, guys. We will see you Sunday. I have got the amazing Laurie Edge Hughes.
Oh, right on.
I know. What? She's right up your neck of the woods. Hey?
She's a little further north, but yep, she's great. You'll have a good time. We're
going to be talking all about manual therapies. We're going to be talking about what you can do with your hands and your dog. So Sunday is going to be epic. And she's
couldn't learn from a better person. She'll teach you so much.
And she's so funny. She's just so funny.
She's a good teacher.
Cool. Right. See you later, guys.
Lori. Bye, Hannah. Take care, everyone.